Hello, I'm Dr. Evie Kemp and welcome back to Lesson 3, Lifestyle-Related Intervention Strategies. So here are our learning objectives. We want to understand how skills of mindfulness-based stress reduction and other approaches can help patients intervene in stress reactions and better care for themselves. So this is what we're going to look at. We're going to look at 5 different ideas about learning to manage stress. First of all, I'm just going to tell you about some very simple breathing techniques. I'll tell you a little bit about mindfulness-based stress reduction, yoga, cognitive behavior therapy, and there's also going to be some stress-busting tips when we get to section 5. So here we go. Here's some breathing techniques. So as we said previously, when we're stressed, our sympathetic nervous system goes into action with shallow breathing and fast pulse, raised blood pressure, and so on. And there is a great technique called 4-7-8 breathing that basically gets your parasympathetic nervous system working and damps down the sympathetic nervous system. It's very easy to do. You simply, when you do this, you breathe in, you try and do diaphragmatic breathing. Remember, you're going to be breathing in through your nose and breathing out through your mouth. So you breathe in for 4, 1, 2, 3, 4 through your nose. You hold it for 7, 1, 2, 3, 4, 5, 6, 7, and you breathe out for 8 through your mouth. 1, 2, 3, 4, 5, 6, 7, 8. And you repeat that 4 times. And it can really just help to calm you down. It's also a great technique to help to calm a patient or client down. Maybe you're with them just before they go for an operation and they're very worried. It's something that you could do together. Or it's something actually, you can teach students before exams, or anybody really, just a really useful breathing technique just to be calm. And here's another one. This one's called the squeegee breath, and it comes from a book called Stop Physician Burnout by Mike Drummond. And this squeegee breath has got 4 steps. And a squeegee, it may not be a word that's used all around the world, so I'll tell you, a squeegee is what you use to clean the window. So that's a squeegee, picture of a squeegee on the right-hand side. You use it to pull down and clean your window. So this is how this breathing exercise works. So the first stage is to release and become present. So there's an intention. You're just going to stop whatever you're doing and you're going to release and become present. The next step is to breathe in, and you inhale and you think about that breath going right up to the top of your head, and you hold it in for 3. 1, 2, 3. You then breathe out and you exhale and you let that breath go all the way down to the bottom of your feet. And then you release. And while you're doing that breath all the way from the top to the bottom, you imagine you've got a squeegee. That breath is like a squeegee clearing the window. It's actually clearing things for you. And then you resume normal breathing, you smile, and you say, ah, and that's a squeegee breath. And again, it's just a lovely thing to stop and do, to just allow yourself to breathe and just to be in the moment. So talking about being in the moment, let's move on to mindfulness. So mindfulness involves paying attention, and it involves paying attention on purpose, in the present moments, and with curiosity and kindness to yourself. And it's paying attention to things as they are now. And one of the things that we do when we worry is we often worry about what's happened in the past, or we worry about what's going to happen in the future. But in mindfulness, you can actually train your mind to focus only on the present, and then you don't get lost in regrets from the past or worries about the future. And if you can let go of these thoughts, it may help you to worry less and accept things as they are. So mindfulness can teach you to be in control of your mind so that your mind doesn't control you. It can help you to say, ah, that's a thought that's come into my mind, not that that's a thought that's necessarily a true thought. So mindfulness-based stress reduction, or MBSR, was developed in the 1970s by John Kabat-Zinn, working at the University of Massachusetts Medical Center. And the course, the MBSR course, is actually an 8-week, 2.5-hour session course, plus a 1-day retreat. And all sorts of techniques are taught on the course, such as the body scan, breath awareness, and visualization. It has to be run by a certified trainer, and it does also involve daily home practice. Now, there is a real growing evidence base for mindfulness, and I thought I would actually get an expert to tell you about this. This is actually Greg Hassard, and he's a mindfulness coordinator at Monash University, and I'd like you to watch this little film. Sorry, we're having just a little bit of trouble with the film here. I'll just go back and forward again.
My name's Associate Professor Craig Hassard, and I work at Monash University, based originally in the Department of General Practice. Mindfulness is very simple. It has to do with paying attention to the present moment, to our life as it unfolds, but also cultivating an attitude with which we pay attention. Researchers and psychologists start to adapt mindfulness to help people with chronic and relapsing depression. And when those studies started to come out showing major reductions in relapse rates, other people started to take it seriously. And literally on the back of the research, it's just gone up exponentially since the early 2000s. To the point that, say, last year alone, 2016, there were just under 700 new papers published in refereed medical, psychological journals. One of the interesting things and the challenging thing for people to understand is how mindfulness can have profound effects on our physical health. Now, to understand that, we need to understand a little bit about the fight or flight response. So for a short period of time, we're faster and we're stronger and we'll have more endurance than we normally have. Now, the unfortunate thing is that when we're not mindful, we often activate that response when we don't really need it. So one of the people to really put this on the map, the chronic effect of this overactivation of the response, was McEwen. And he described what he called allostatic load, physiological wear and tear, like flogging the car day in, day out. And that's associated with a poor immune function. We get less defense against coughs, colds, infections. We're more likely to get sick during periods of high stress, but we get more inflammation. The technical term's immune dysregulation. Metabolic effects, blood pressure, blood glucose, blood lipids are out of whack. It thins our bones. It increases the rate of atherosclerosis, the hardening of the arteries that leads to heart attacks and strokes and so on. If we wanted to accelerate aging, this is how to do it. But it damages the brain as well. So these stress chemicals day in, day out damage areas that are very important, like the hippocampus, so that's our learning and memory center of the brain, and the prefrontal cortex, so that's working memory and executive function. These are our higher functions. And damaging those areas of the brain is not what we want to do. The effects of this high activation of the stress response and so on, the psychological, emotional stress, has even been found to go right down to the DNA of our cells. So Elizabeth Blackburn, an Australian woman who won the Nobel Prize for Medicine in 2009 for discovering telomeres, she and her team, Elisa Epel, particularly prominent among her team, have found that overactivating this response accelerates the aging process as measured by DNA in terms of telomere length. So we can be about a decade older by middle age if we've got high levels of anger and hostility and stress and so on, compared to somebody who might have the same situation in life but is getting less stressed and reactive over them. The interesting thing is, when we practice being more mindful, then it switches off these distracted default circuits. It engages the sensory areas and the attention centers of the brain. And when we're sitting down practicing mindfulness meditation, those centers in our brain are getting a workout. It's like they're going to the gym, right? They're lifting some weights, they're on the treadmill. It starts to have a whole range of positive effects on the health. So we get immune regulation. So better immunity, we're less likely to get sick with coughs, colds, infections. It switches off excessive inflammation, takes stress off the cardiovascular system, switches down cortisol, all the damage that it has on the bones. Elizabeth Blackburn and her team have been doing work on that in a whole series of studies that started, the first one published in 2009, that showed that mindfulness switched on the repair enzyme called telomerase and has been found to slow down the rate of aging down to the DNA of the cells. If that was a drug, that would be a blockbuster drug.
Wow, fascinating research there from Australia. So let's move on to yoga. So I'm sure many of you know about yoga and maybe have practiced yoga. It's a very old tradition. They say up to 3,000 years old, originating in the Indian subcontinent. And it's a tradition of physical and psychic practice. The word yoga is actually a Sanskrit word meaning union, yoke, attach, or join. And yoga practiced in the West is primarily asana-based, that's with physical postures, with varying degrees of breathing techniques and meditation as well. But there are many different types of yoga that are practiced in different places around the world. So what about the evidence base for yoga? Well, this is a very interesting review that I found looking at all the studies published between 2011 and 2013, and they actually found 17 studies, of which 12 studies showed improvements in physical or psychological measures related to stress. Now, only 8 of the studies were randomized controlled trials, so there were some methodological flaws that were flagged up. Other flaws were that some of the sample sizes were very small, the interventions weren't standardized, and the interventions were of varying lengths. So the conclusion of this study is that they're very promising results, but we need more research in this area. Let's move on to cognitive behavior therapy. And I'm actually trained in cognitive behavior therapy for occupational physicians. Let me tell you a little bit about it. So this wonderful man is Professor Aaron Beck. He is an emeritus now psychiatrist. He was born in 1921. He's now 99 years old, and he became a psychiatrist at the University of Pennsylvania. And he's very much the father of cognitive behavior therapy, or CBT, as we call it. And he did a lot of the work in the 60s and 70s. And this is a definition of CBT from the Royal College of Psychiatrists in the UK. So CBT is a way of talking about how you think about yourself, the world, and other people, and how what you do affects your thoughts and feelings. CBT can help you change how you think, that's the cognitive bit, and what you do, that's the behavioral bit. And these changes can help you to feel better. So what about some of these underlying principles? Well, it's based on something called an evolving formulation, which I'm going to show you in a minute. There's very much an initial emphasis on the present and what's happening in the here and now. And it involves a whole load of different techniques to help the patient or the client change the way they're thinking and their behavior, and that in turn can positively affect their mood. There's also a very important relationship between the therapist and the client, and homework is an important part of this. So let's look at this 5-area formulation. And the idea here is that everything is connected. So our body, our mind, our emotions, our behavior, our mood, everything is connected. And of course, we're surrounded by our environment as well. So we can actually, and the important thing is that this 5-area formulation outlines the problem as it is now, and it's used as a basis to plan, structure, and assess how treatment is going. So this is how we draw that 5-area formulation. Here are these areas, as we said, our behaviors, our thoughts, our emotions, and our biology, everything's connected. And of course, our environment impacts on that. So I just want to do a little exercise with you to help you understand this a bit better. And this exercise is called the HOT date exercise. So I want you to imagine, and maybe you are, but imagine you're young, free and single, and you've been invited out on an amazing date by a certain gentleman or a certain lady, and they are coming to pick you up at 8 o'clock this evening. You get ready, you put on your nicest clothes, you have a shower, you put on your nicest clothes, you get ready, you're very excited. It's 5 to 8, you're just waiting for them to come and pick you up. 8 o'clock, you're jittery, or where are they? 10 past 8, they're still not here. 8:15, they're not here. You start texting them, where are you? And you try and phone them. Absolutely nothing. So by 9 o'clock, it has become very clear that you have been stood up. Not a nice thing to happen to anybody. So this is what's happened to you. You've been stood up. So what I want you to do now is just get out a paper and a pencil or a pen. And I want you just to write down, what are you thinking? What are you going to do? What are you doing? How's your body feeling at the moment? What's your emotions and how are you feeling? So I want you to write down now how you're feeling and what you're doing in these 4 areas. And if necessary, just stop the video, just stop this for a second so you can actually write that down yourself. Okay, but I'm going to carry on. I'll let you stop it if you need to. And let's have a look, because there are several different ways that you can look at this. And let's look at maybe the 2 extremes. So here's somebody that's been stood up. What are they thinking? They're thinking, oh no, there must be something wrong with me. What have I done wrong? Why haven't they arrived? Must be something wrong with me. What's happening in their body? Well, they're feeling really anxious. They're having palpitations. Their tummy is churning. They're almost having a panic attack. What do? Well, they decide they're so miserable, they're going to run a bath, and they're going to wallow in the bath all evening with a bottle of wine in one hand and a tub of ice cream in the other, remembering that wine is obviously a depressant as well, and, you know, just sitting there quietly crying to themselves. And how do you think they're going to be feeling by the end of the evening? Well, they're going to be feeling miserable and anxious and pretty sad with a pretty low mood. Okay, so just bear that in mind. That's kind of one extreme of the options here. Let's have a look at the other extreme. So the other extreme is same situation. This person has been stood up. What are they thinking? They're thinking, oh gosh, I hope they're okay. I hope they haven't had a car accident on the way here. It's their loss. It's really their loss if they haven't come. You know, I'm a good person. It's their loss. What's happening in their body? Well, nothing particularly. Their body is just fine. What do? Well, they think, you know what? I'm not just going to sit here and be a little bit sad on my own. I'm going to phone a friend and I'm going to go out anyway. And how do they feel at the end of the evening? Well, they're thinking and feeling, well, it's a shame about the date, but actually I had a great time with my friend and I'm feeling fine. So you can see the same thing that's happened to both of these people, but at the end of the evening, one of them is feeling fine and the other one is feeling absolutely awful. And it's all about how they're thinking, what they're doing, what their behavior is, and what's happening in their body. And I just wanted to show you how this is all connected. So that's just a little bit of understanding of some basic cognitive behavior therapy. So that's I think we finished now for session 3, for lecture 3, and I look forward to seeing you again soon. Bye for now.